What is the number one way that healthcare is going to change? Well, it might not be number one, but it's going to be like close number two. And that is employers are no longer going to allow their patients to go to hospitals. Why? Hospitals generally have a readmission rate of somewhere between 8 and 12% for commercial insurance. 8 to 12% get readmitted. That's a big number. Infection rates before coronavirus were at sky high levels of 3.1 to 4%. That's crazy. You know what surgery centers and surgical hospitals are? Oh, okay. AKA, they're also owned by physicians. I know that's terrible, but they're owned by physicians, unlike hospitals. Significantly less than 1%. So what's the difference? Well, hospital and health systems are owned by bean counters and big corporations, right? They say they're tax exempt. They say they're not for profit. They cost a lot of money. Then there's physicians, hospitals, ambulatory surgery centers, and they're owned by physicians in private practice. You know, the ones that have to get the small business loans that the federal government's trying to give out now? Of course, they're going to give like $100 billion to the health systems. Why? Not to make sure doctors get paid more, not to make sure nurses get paid more, but to make sure the fat cats get to put the money in their pockets. That's crazy, right? Like, I never dreamed it would work this way. But this is what happens when we allow for crony capitalism. This is what goes on. This is what occurs. So now physicians aren't in charge of healthcare. Non-physicians are in charge of healthcare. Nurses aren't in charge of healthcare. Non-nurses are in charge of healthcare. Can you imagine me doing your surgery? You don't want to imagine it. I would totally butcher it up. I don't like the side, like it wouldn't work, right? How hard is it? How hard is it for physicians to be in charge of what it is physicians do? How hard is it to make sure that nurses are in charge of what nurses do? See, we've got this wonderful thing in our country called laws. And these laws are largely skewed against physicians and against nurses. Why? Because nurses and physicians are busy doing work. While America binges on Netflix and watches the latest Hulu, the latest one's Disney. While Americans are busy doing that, not staying in their houses, not doing what they're supposed to, guess what? Physicians and nurses are working. Interesting, isn't it? Why don't we go back to how it's supposed to be? Physicians are supposed to own hospitals. Nurses are also supposed to own hospitals. Dr. Brickner on LinkedIn had an excellent video this morning about the number of board seats assigned to physicians and nurses. As you can imagine, it's a very low number. Very low number. Why? Because business people that are trying to extract revenue that's unfairly earned don't want to hear from the people who want to do the right thing for the patients. They don't want to hear about it. Politicians, you know why we have certificate of need in 35 states? Why New York doesn't have enough beds? Because politicians don't want to create competition. They hate the free market. They spend millions of dollars, paying marketing companies to tell you what capitalism is. Capitalism isn't unfettered. Capitalism creates competition. Competition creates lower prices and higher quality services. See, but that's not the case in 35 states. In 35 states, a physician who's an entrepreneur or a nurse who's an entrepreneur says, I want to open something. I want to do it on my own. And you know what happens? Is these little people go like this. Oh, no, you can't do that. That's for patient safety. That's the reason New York State doesn't have more hospitals. It's the reason New York City doesn't have more hospitals. It's in the best interest of patients for us to have full hospitals and for you, nurse, you, physician, to just go and do what you're supposed to do. Get out of here. That's the way government and that's the way big business likes to treat entrepreneurs. But here's what's going to happen is all the self-insured employers we're talking to, by the way, that 70% of all employers over 100 are going to massively steer patients to physician-owned facilities. Why? Because it's safer, it's 50% less, and the quality is higher. It's not hard to imagine that Americans would finally get some logic into their healthcare choosing purchases. I don't care if the physician that's your cousin's best friend tells you, well, for your total knee replacement, you ought to go to the hospital under this doctor. Call the doctor and ask them to do it at their own center. It's pretty simple. The days of physicians and nurses not running healthcare are over. Most employers are on this message. Make sure that your plans for next year, if you're a consultant, advisor, broker, whatever you call yourselves, because you got all kinds of names, make sure you're steering them to the right place. Yes, I said steering, like we do with, yeah, that's what I said. If I was being more of a business guy, I'd say leading, guiding, and directing. How do I know? Because I made up that phrase. It sounds terrible, especially in a crisis. And we're going to steer you. Health plans aren't doing what's in your best interest. I don't care who they are. I don't care if they tell you they're the kings of free market everything. Health plans are not going to steer you in the right direction. You have to steer you in the right direction. Employers have to push on employees to steer them in the right direction. This is all going to work. Healthcare will be 100% better and 50% less in total expenses if nurses and physicians together ran healthcare, and when employers start making sure that their patients, especially the healthy ones, stay out of the hospitals. If you're going to have a baby, you need to go into a hospital. If you have a heart attack, you need to go into a hospital. If you have an emergency and you get in a car accident, you need to go into a hospital. Other than that, you need to have a direct agreement with all the surgeons in your community, and some that are not. And then you got a real health plan. Then you have real health care. Rojas out.